Introduction. The PureWick Flex female external catheter is intended for non-invasive urine output management in adult users with female anatomy for conditions such as urinary incontinence. The PureWick Flex female external catheter is contraindicated in users with urinary retention. The PureWick Flex female external catheter can be curved to fit the user's anatomy to help the product stay in place, and utilizes continuous suction to wick urine from the device into the designated collection canister. It is important not to block airflow to the product, for example, block the vent hole using barrier creams or bedpans with the device. Setup. Prior to starting the procedure, obtain all necessary supplies: clean gloves and the PureWick Flex female external catheter. Explain the procedure to the patient. Wash hands and put on clean gloves. To set up the PureWick Flex female external catheter device, connect a canister to wall suction and set to a minimum of 40 millimeters of mercury continuous suction. Although different setups require higher suction, typically between 60 and 100 millimeters of mercury, always use the minimum amount of suction necessary. Add duration label, and using standard suction tubing, securely connect the device to the collector tubing. Pericare and placement. Before placing the product, curve it to fit the user's anatomy. This helps the product stay in place. Have the user lie on their back with knees bent and thighs apart, on their side or frog-legged before placing the product. With their legs open, check the skin for irritation or breakdown and clean the female anatomy with included Pericare wipes. To place the PureWick Flex female external catheter, spread the inner labia and keep them spread while placing the product. With white wicking material side facing the user, place the bottom end of the product between the buttocks, but not as far back as to cover the anus. Gently tuck white wicking material side between the inner labia, directly against the urethra. Make sure the urethra is at least 1 inch down from the top of the white wicking material. Make sure the inner labia wrap around the product and are not tucked under it. Once the product is in place, slowly close the legs and make sure the vent hole is not covered. Removal. To remove the device, open the legs and gently spread the labia. Gently pull the product away from the body. Make sure to keep suction on while removing the product. After use, this product may be a potential biohazard. Dispose of in accordance with applicable local, state, and federal laws and regulations. Maintenance. Replace the PureWick Flex female external catheter every 12 hours or if soiled with feces or blood. It is recommended to reposition the device and check the patient's skin at least every 2 hours. Indications, warnings, and precautions. Indications. The PureWick Flex female external catheter is intended for non-invasive urine output management in adult users with female anatomy for conditions such as urinary incontinence. Contraindications. Users with urinary retention. Warnings. The PureWick Flex female external catheter is designed for single-use only. Trying to wash, sanitize, or reuse it may lead to risk of infection or illness. This may damage the product and materials. The product may not work and cause injury or illness. To avoid potential skin injury, never push or rub the product against the skin during placement or removal. Do not block airflow to the product, for example, blocking the vent hole, bedpan, barrier creams. Do not insert the product into vagina, anus, or other body orifice. Stop use if an allergic reaction occurs. After use, this product may be a potential biohazard. Dispose of in accordance with applicable local, state, and federal laws and regulations. Do not use on users with frequent episodes of stool incontinence without a fecal management system in place. Do not use on users with skin irritation or breakdown at the site. Use with caution on users who had recent surgery of the external female anatomy. Do not use on users with moderate to heavy menstruation who cannot use a tampon. MRI warnings. Always disconnect the PureWick Flex female external catheter from wall suction or the PureWick urine collection system prior to an MRI procedure. It is important to closely follow these specific conditions that have been determined to permit the examination to be conducted safely. Any deviation may result in injury to the user. Precautions. Use with caution on users who are agitated, combative, or uncooperative and might remove the product. Do not use barrier cream on the surfaces where the product will be placed. Barrier cream may reduce suction. Keep suction on while removing the product. This helps prevent leaks during removal. Recommendations. Check position of the product after repositioning the user. Users may transition, for example, bed to chair, but the product should be removed if they are up and walking. Reposition the product and check the user's skin at least every 2 hours. Placing the product snugly between the inner labia and buttocks holds it in place for most users. Breathable underwear may be useful for securing the product for some patients. Change the suction tubing and canister per facility protocol or per PureWick urine collection system instructions for use. Keep track of how long the product has been in place by writing down the date and time it was placed on the included duration label. Before connecting the product to facility wall suction tubing, verify suction function by covering the open end of the suction tubing with one hand and looking at the pressure dial. If the pressure does not increase when the line is covered, make sure that the tubing is secured, connected, and not kinked.